Welcome to Healthy Talk, empowering your wellness one conversation at a time. I'm your host, Rachel Mann, and today we are excited to have Kathy Chapple, the program director here at Boone County Hospital's Wound and Hyperbaric Center, joining us. Kathy, welcome to the show.
Hi, thank you.
Let's start from the beginning. Could you share a bit about your journey to becoming the program director of the Wound and Hyperbaric Center?
I previously was a nurse in med-surg. Had a little bit of wound experience there when I first started as a baby nurse. Ended up going on into becoming a diabetic nurse educator, working with the tribe in Kansas and doing clinical education and diabetes nurse, and did a little bit of wound care there. Became a DON and RN at a skilled nursing facility where I really got more hands-on with wound care. I actually used to pass out the sight of blood, so never thought nursing would actually be in my future, especially wounds. It's kind of a love-hate relationship with wounds and nurses. I started doing wound care there and just fell in love with it. And when COVID hit, I just started getting a little bit burnt out and decided to do something different, something that I wanted to, enjoy going to work. And a position opened up with my wound management company, Restorix Health, and I jumped at the opportunity, and I've been with it since. I started off as a clinical coordinator with the company and ended up getting promoted to program director, and now am here in Iowa.
That's awesome. What exactly does the role of a program director in this specialized medical field entail?
Kind of a jack of all. Basically the oversight of the wound clinic program in general within the hospital. As a program director, I am considered a district program director. So I work here at Boone County Hospital. I work with the oversight of the program, looking at budgets, reports, making sure that we're meeting our quality data. Are we getting our good wound healing outcomes with our patients? What do we need to be doing differently? What are we doing well? We work at the hyperbaric chambers as well, trying to do some marketing and education within the community, within the walls of the hospital as well. And I also help with hands-on care.
Okay, so we had Dr. Erickson on the show earlier this month, since April is Foot Health Awareness Month, and he talked a bit about the wound clinic, so we thought expanding upon that with you as our guest would be great. So for those who might not be familiar, could you describe what wound care and hyperbaric medicine involves and why they're essential?
Wound care in general is very essential. We deal with a lot of patients that have wounds that are very chronic. We specialize in chronic wounds. We do deal with acute wounds like surgical wounds, traumatic wounds, things like that. But overall, the majority of what we see is chronic wounds. It greatly impacts your life, your daily living skills, can impact your mobility, your mentality. Are you able to get out of the house? A lot of depression, things like that can set in. So with the wound clinic, what we do is we work with those chronic wounds. We bring our patients in. We're going to evaluate them from day one, make sure that we do a comprehensive approach. We look at how long have they had the wound, what kind of wound is it, what treatment modalities can we offer, what can we do to get them more mobile, to get them offloading, to do different things to try to get that wound to heal in a quicker time. A median on average is 32 days or less. Not everybody is going to meet that benchmark. However, some of the patients we see have wounds for years. So we try to get them healed as quickly as possible and working with different collaborative approach and different doctors to try to get that outcome for them.
What types of conditions do you treat most frequently?
Definitely diabetic foot ulcers is very common, venous ulcers, arterial ulcers, a lot of surgical wounds, skin tears, lacerations, burns. Okay. We kind of deal with it all.
Can you walk us through the typical patient journey from referral to treatment and follow-up?
We get a referral. It doesn't necessarily have to be from a provider. We can do a self-referral from the patient if they want to be seen. Okay. Once we get the referral in the clinic, we're going to schedule them within our clinic, trying to find a provider availability depending on what the need is. We do have a podiatrist, a PA, and a MD on our panels. They're all great. They work well together, a great team. So we get the patient in there. We're going to do a comprehensive evaluation of the wound, make sure that we're diagnosing it correctly. What kind of treatments can we offer? We do have a lot of advanced modalities. A lot of the times when we have a patient come in, they're going to be expected to come back and return weekly for debridement. So when we debride, we're cleaning and scraping out that wound, getting rid of all the stuff that doesn't need to be there, sure, and make sure that we're giving it the best chance to heal and overcome a lot of the bacterial burdens that they've had. So they're going to usually come back weekly. We're going to do their treatment regimen until we see them through the end, until they heal out. Okay. And if for some reason we can't get them to heal, we're going to make sure that we can collaborate with somebody else to try to get them to help us as well.
Gotcha. How does the Wound Center integrate with other departments and services within Boone County Hospital?
Right now, the Wound Center sees a majority of the wounds that come through the hospital. They're inpatient. One of our wound nurses will go down and do a patient consult and kind of help with the treatment regimen and make recommendations along with our providers. We also do consults within the ER. I've gone down to Senior Solutions and kind of just worked with patients down there and just kind of educating, making sure that they know that our services are here and that we're available when they need our help.
Before I worked at the hospital, I had never heard of hyperbaric oxygen therapy, but since working here, I think it's so interesting. Could you explain how it works?
Once we get the patient approved for hyperbaric oxygen, or HBO, we are essentially going to put them in a big glass chamber. For a patient that's not really sure what it looks like, I try to refer to the old iron lung chambers, only glass and see-through. Not quite as big, but they're essentially the same kind of thing. With that, the patient's going to get inside the chamber. We're going to put 100% oxygen into that chamber and kind of pressurize the chamber. So it's going to be 2 to 3 times greater than atmospheric pressure or something equivalent to deep sea diving.
Okay.
That pressure with the oxygen is going to hyperoxygenate their lungs and help distribute oxygen concentration throughout their body and push it into the plasma to the cellular level to help to heal them from the inside out. It's very fascinating. There are so many different modalities that can be covered for that. However, we have to follow the UHMS guidelines. So indications that we most commonly treat are diabetic foot ulcers, has to be a certain severity. We can deal with soft tissue radionecrosis, is tissue damage from delayed effects of radiation. You don't always have a wound, and it's usually on the inside, so we heal them again from the inside out. So we have patients that deal with any kind of soft tissue radionecrosis. They might have different symptoms from that radiation even 20 years ago that are showing up now, so we can get them in the chamber. Most common is diabetic foot ulcers and STRN, which is the soft tissue radionecrosis that we deal with. And I will say, of the ones that we get in the chambers, they seem to be the ones that you see the best results quicker. The other ones still take a little bit of time.
And it's just, all it is 100% oxygen.
100% oxygen being pressurized in the chamber, yes.
That's crazy. That's so crazy that is so healing. Are there any common misconceptions about HBO?
Some providers are really on board with providing HBO therapy to the patients and some are not. And generally it comes down to education or lack of education. Some providers just don't think it works. Some people don't think it works. Well, it has proven studies behind. I mean, we have science backing the efficacy of a hyperbaric oxygen treatment. So working with that, since I started working with that as a program director, I've definitely seen the results. And again, the ones that, for instance, soft tissue radionecrosis, I've seen the most efficacy from that, from having a patient come in and having all these different symptoms and then having the alleviation from those symptoms fairly quickly. A lot of the wounds can heal. You're not always going to heal every wound. It's just an adjunctive therapy. For the most part, it can be primary therapy for some indications. However, it is a modality to try to help in addition to other treatments. I think to overcome some of the misconceptions with hyperbaric oxygen treatment is by being persistent and providing that educational tool and getting out and discussing what it is and the effects of it and how it's treating our patients. And again, just being very persistent and getting the information out there to the providers and the patients as well.
How does the Wound and Hyperbaric Center measure success in patient care, and what benchmarks are used?
So I'm here at Boone County Hospital, but I'm also part of Restorix Health. So with that, we do a lot of quality data. We extract a lot of different data to make sure that we're meeting goals within our clinic and making sure that we're getting optimal outcomes for the patients. So with that, we're looking at our median days to heal. Our goal with the benchmark for nationally in our company is 32 days or less. We do an arterial brachial index. We're taking a blood pressure cuff to the lower extremities and we're getting a number like you would a blood pressure on your arm. And that's going to give us a number that tells us whether or not they have an adequate blood flow throughout that lower extremity. So if they have adequate blood flow, it helps to have a more optimal outcome in healing that wound. If you don't have good blood flow, it's really hard to heal a wound. You need blood flow. So we make sure that we're getting ABIs on our lower extremity wounds. We're making sure that our diabetic patients are getting their A1Cs and that they're being controlled. We also look at patient satisfaction. We look at our healing percentages of the patients that we have, what percent are we healing. So we take all that data and we're kind of pulling it together and making sure that we're meeting our national benchmarks and that we're providing the outcome that we're wanting to see for standard of care.
Did the Wound and Hyperbaric Center just get an award recently?
We did. We got National Center of Excellence Award through Restorix Health, and there's quite a few different benchmarks that we have to meet to get that. It is the first time in, I think, the 3 years that Restorix has partnered with Boone County that we have received that. Again, that's going to entail making sure that we're getting our ABIs, that we're getting the A1Cs, that we have a good healing outcome, a good percentage. Our patient satisfaction scores play a part of that. Are we meeting their need? They're the reason we're here, so we have to make sure that we're doing right by them. But we did get the national award, so it was a lot of work, and everybody's pretty proud. So thank you.
What are some of the biggest challenges in wound care and hyperbaric oxygen therapy, and how does your team overcome them?
So I think of 3 different challenges when I think of wound and hyperbaric treatment. One being education, just knowing what services are out there, knowing when to come and obtain those services, and for a provider, when to send them our way. Generally, when we get a patient, a lot of times our providers in the Boone community are really good about sending them early on, but in history, I've seen so many patients that have come in way past start of that wound, and it's just a train wreck. And it's to the point that if we would have got them in sooner, it would have been something that we could do a little bit more for them. So it's trying to play catch up the whole time. So I think one thing would be educating providers and patients alike that if you have a wound, just get in to be seen so we can go ahead and get started on that. The sooner the better. 2 would be compliance. Compliance is always an issue. Patients being able to come to the appointments, being willing to come to the appointments. It's a big commitment, especially when they have any kind of type of chronic wounds or hyperbaric treatment, just to try to get them in the door to make sure that we're meeting their needs and that they're able to help on their part too. And I think insurance coverage too, especially for hyperbarics, it's such a great modality to offer our patients. But again, it is only covered for certain indications. Having the ability to pay for that outside of that is really detrimental to some, because there's so many things that hyperbaric treatment covers. It's just off-label uses right now. So hopefully down the road, they'll get more coverage for that.
Are there any recent technological or therapeutic advancements that have significantly impacted how you treat patients?
Definitely. I'd say the top 2 that come to mind are skin substitutes and hyperbaric oxygen treatment therapy. Skin substitutes has been around for a very long time. And when I was a brand new baby nurse, one thing that got me interested in the wound care was I followed a patient at a bigger hospital that had a skin substitute put on. I never heard of it in my life. It was newer at the time, but it had been used, very costly, but they've really kind of expanded on that over the years. There's a lot more out there to offer patients and a lot more different treatments. So a skin substitute is going to be a product that we can place on your wound to help regenerate your own tissue. There are different types of skin substitutes. They could be collagen, they could be amniotic, they could be from a placenta. All of that's going to work with your own tissue to kind of help regenerate new tissue.
How do you see the field evolving over the next few years?
When I think of wound care back in the day, I think it was just wound care. You did basic wound care, and now it's becoming its own specialty. Like you have cardiology, you have urology, you have podiatry, but then we have wound care, and wound care is going to encompass every type of wound possible. I think it's going to continue to evolve. It's going to continue to grow. I think providing that education within the communities, it'll become more prevalent. I'm hoping hyperbaric treatment will become more common and that the treatment will be available for more indications and covered by insurance, because there's so much more that it could help with.
What future developments or initiatives at the center are you most excited about?
Actually, we were discussing becoming part of the Senior Resource Fair and doing a booth upcoming in October, so pretty excited about that. I'd love to get out and educate, getting the information on the wound clinic out into the public. I'm pretty excited about that, and some of our team will be there as well.
We've talked a lot in other podcasts about how fortunate we are in a rural community to have the resources that we do.
We are very fortunate that we have a 5-day-a-week wound center and that we're able to offer the hyperbaric oxygen treatment, because a lot of centers do not offer that. Again, it helps to alleviate having patients to go out of town and take that out to other communities and be able to keep it local. We have a great team most of them are local from this area, so they know a lot of the patients, and I think that helps to get patients to come here. We actually had a patient recently who requested to come to hyperbaric treatment here because the parking is better. So I thought that was really funny. I wish we could go out and hold the signs like, come to Boone, we have better parking. So I think the fact that we have the wound clinic to offer to the patients is such a great tool and modality to have.
Yeah. What ways does the center engage with Boone County community to educate about wound care and prevention? You said you're doing the
Senior Resource Fair. So myself and my role with the program director, and along with some of the team members, get out and try to do some education. We've gone to surrounding communities and providing wound education, what services we offer to other hospitals, to other providers. I've gone to the Adult Day Center to provide education to those that partake in those services. We've done senior solutions. A lot of it is just really talking about what do we have here at Boone that we can offer for you to stay local, to help keep the care here and make sure that we have a comprehensive approach as much as possible to keep everybody local. Nobody wants to send patients out to other places if we can keep them here.
Right. So. Yeah, exactly. How important is continued education and training for you and your staff?
Very important. As a nurse in general, you have to have continued education, anybody in the medical field, to make sure that we're up to par, that we're able to provide the services that we do. I think education in general is important no matter who you are. It's constantly evolving, it's constantly changing, just making sure that we're up on the new trends. What do we have to offer, and are we changing anything? And one thing great about partnering with Restorix Health is we have the capacity to be able to offer more education within our confinements of our clinic. What can we do? What classes, what webinars, what can we offer anybody? We also work with, some of the nurses are working on getting wound certified. I'm actually working on that as well. I've been in the wound care industry industry for a little while, but I've never been wound certified, so I'm actually finishing that. We just have to make sure that we stay up to date on what services we have and treatments. Is anything changing to make sure that we're providing the best treatments, the best care we can.
What do you find most rewarding about your work?
Definitely building the rapport with the patients, getting to see them day in and day out. We see patients on some of the worst days of their lives, just like you would any other place, in the hospital. But seeing them overcome the struggles that they've had to deal with for the last year or two with those chronicity of the wounds and seeing that end result of having them heal.
Before we wrap up, is there anything else you'd like to share with our listeners about your work, the center, or the importance of specialized wound care and hyperbaric medicine?
Don't wait. It is absolutely imperative that if you have a wound that you get seen, whether that's with the wound center, your primary care provider, the ER, wherever you need to go for that wound. Wounds have the tendency to fester. They can change very fast. And so getting that wound treated early on really helps to prevent any kind of further seriousness or severity of that wound later. We have a great team with a variety of years of experience with wound care under their belt. We have Dr. Till, who's our medical director. We have Mallory Bender, who's a PA. We have Dr. Erickson, who's our podiatry panel physician. For the nursing staff, we have Tara Lecker, who is an RN, Mariah Sharp, RN, Kaylee Casey is an RN, Mary Elliott is an RN. We have myself, and then we also have our front desk coordinator, Heather Anderson. They are wonderful, very welcoming, very warm, and very inviting with the patients. One of the things I love the most when we get patient satisfaction surveys is reading the comments about how great the patients feel. And like I said, they're coming in, they're not having a good time when they're coming to see us. They're coming in for wound care. Nobody wants to come in for wound care. But when they make a comment on the patient satisfaction survey that we send out and say that they enjoy coming because we make them feel like family, it is very rewarding to know that this team goes above and beyond to make sure that the patients feel welcome and that they feel cared for.
It has been an absolute pleasure having you on the show. Thank you for sharing your insights and experiences with us.
Of course. Thank you.
And thank you, listeners, for tuning into Healthy Talk. For more information about Boone County Hospital's Wound and Hyperbaric Center, visit www.boonehospital.com. Follow Boone County Hospital on social media or call 515-433-8740. Be sure to subscribe so you don't miss an episode. Until next time, stay informed, stay healthy, and keep the conversation going with Healthy Talk.